Welcome, welcome. Just waiting for a few folks to join in. While we're waiting for folks to join in, I always love to know where everybody is dialing in from. So let me know. I'm in the Washington, D.C. area. I'm in the nation's capital. I grew up here. I've lived all over the U.S., lived abroad, and now I am back home a couple miles from where I grew up. So just waiting for everybody to go ahead and sync on in. And once you are in West Virginia, currently working in Pennsylvania, what are you doing in Pennsylvania? Are you visiting family or are you on a vacation and just kind of working remotely? Best part of working remotely is you can be anywhere. Isn't that true? But good to have you. And we have Lauren on here. She's my moderator. She is the blue background with the lotus. So just waiting for folks to join in. Let me know where you're all coming in from tonight. And while we're waiting for folks, I want you all to, yes, acupressure can definitely stabilize hormones. I've definitely seen it in my lifetime, definitely for women's health and men's health specifically. But I guess that would be most genders. So there you have it. Oh, thank you so much. Thank you so much, Braided Punjabi. It's really sweet. I feel good. Today was a long day. I work at a hospital and I came home and I actually wanted to do the live earlier. Hey, there you go. Yes, I was away in India, but glad to be back. Just okay, fantastic. We've got a good amount of people, and today is Tuesday in the middle of July, and I'm sure everybody's enjoying this beautiful weather. So, everybody get into a comfortable place wherever you are in the world. We're going to do a 3-point protocol to help with anxiety, stress, and sadness, get you into a good place. Then we're going to do aches and pains, and then we're going to open it up for questions. So first thing, oh, thank you, Gracie. Oh my gosh, thank you so much. You guys know, oh my gosh, you guys are so sweet. My India trip was fabulous. I scoped out locations for another free clinic, and I got to see family after COVID. Thank you so much for asking. And last week was my birthday, so all good. You guys are wonderful. All right, hello there, Texas. Okay, let's get going on the acupressure. First point we're going to do is we're going to start off with a bang. You guys like the ear points. Let's go ahead and start with ear shen men. You know the drill. You've been with me for a while. And so we're going to go ahead. If you have the ear seeds, you can go ahead and slap the ear seeds on this point, both sides, and then you can put your feet up. And if you don't, let's do it together. Let's go ahead and do this together. So first, where's my pencil? I like to do this point with a pencil. So let's get into a comfortable point and let's do this. We're going to go ahead and right here in this spot, we're going to massage. I want you to do these points for a couple of minutes, but we are going to just do it for 30 seconds to a minute in the interest of time. And yes, Lauren's right. Lauren's my moderator, and she is absolutely right. Check out my YouTube channel. We are doing short series, and they're doing really well. We just released one yesterday. I think it might be close to 700 views already. For us, that's really good in one day. So do check us out on YouTube. Great informational free courses to help you along the way. And also what is the purpose of this? Good question. This one is to help with stress, anxiety, sadness, if you're feeling angry, if you're just having an off day, if you had a fight with your boss or your partner, this is a great point. I want to give you a set of points that you can do to help you. This is a great anti-anxiety, anti-frustration, anti-emotion point. So I'm giving you a set of points that are going to help you feel better and also is going to help you to sleep. So this is a great point that you can do. I like to do the points bilaterally, which just means on the other side. Let's go ahead and do the point. So let's go ahead and do this point for just another 30 seconds, and then we're going to do another set of points, and then we're going to do a bunch for aches and pains. So I want you guys all doing the points with me. This set of points is going to help you, make you feel so good. It's just, wash away the day, whether you're angry, pissed off, frustrated, sad, anxious, panicky. This is just going to help you. And this, if you do this point, it's going to help balance out your emotions, which will balance out your hormones, which will help you for weight loss, fertility, or gentlemen, it's going to help you in the bedroom. So really good point that we can do. All right, next point we're going to do is also in the ear. And this point I think the ear has a great amount of hormones and endorphins and serotonin, opioids, dopamine. It's going to help release your happy chemicals. So if you get nothing from me tonight, you're going to feel really, really good. And so that's going to help you. So this one has kidney, liver, and endocrine. Again, kidney, liver, and endocrine. So we're going to go ahead and do the inner ear, and we're going to do both points like this. So let's go ahead and do that. You can use a pencil or any of our tools or devices. I want you to go to the second link in the bio, and you can find all of them. So let's go ahead and do this right here. Oh, it feels so good after a long day. Acupressure point to unclog wax in the ear. You're funny. I don't have a point to unclog wax in the ear, but what I can tell you is that if you eat less damp foods like cheese and stuff, you won't have as much I guess dandruff, not dandruff, but earwax is probably the way to go about it. So if you're just joining us, we're doing a 3-point protocol to help with stress, anxiety, sadness, anger, just help you wash away the day, help you get into a really good place. So this point right here is going to help you to release that stress and help you to sleep. We did ear shen men, and now we're doing these points on the inner ear that will help you. Okay, yes, both ears, dear, both ears. Let's do the other ear. I want you to do all the points for about a couple of minutes. We're doing them for 30 seconds for illustration purposes. So I want you to consider doing this with me for just about 30 seconds, and then we're going to go ahead and move on. But I want to give you tools, tips that you can do when you're feeling not so great, and I want to help you to feel your best self. So really, really good points that you can do. And I already feel better. I had a tough day at the hospital. You guys had a tough day? I had a tough day. So I'm already feeling better doing these points. Okay, next point that we're going to do is we're going to do it on the face. It's going to help make you feel real refreshed. And again, remember, acupuncture is based on mirror imaging. So we have the mirror image here. We also have the mirror image here. We also have the mirror image here. We also have the mirror image here. We have the mirror image here. So what I want to do is help redistribute the serotonin in the gut. 90% is in the gut to the rest of the body, so that if you feel better, you can just, sleep better, and you're going to have more resources to help you make better decisions, and your body's going to function better. So that's going to help you for the weight loss journey, as well as men's health and women's health. So we're going to go from yin tong above the eyebrow to the temple, all the way along the jawline, all the way up. So I want you to consider doing this with me for about a minute or so. This always feels really good. And so if you're just joining us, I want you to do these points. They're going to help you with stress, anxiety, help you sleep better. And yes, good way of saying it. Unlock the hidden dopamine. Very good way of saying it. Yes, and my goal is that you have some tips, your tools, if you're having a tough day, that you can do them, and these are going to make you feel better. I'm already feeling better, so I want to give you things that are going to help you to feel better. Whew, you guys feeling a bit good? Okay, awesome. So one thing I want to just mention is that if I can help you have the stress, your pain levels aren't going to be as high. Thank you so much, Gracie. Really, really appreciate it. So I really am trying to give you points that are going to help you sleep well, rest well, remove that anxiety so you can go about your day. And today's topic is really aches and pains. A lot of you come to me wanting to know about headaches and also wanting to know about sciatica and back pain. So I want to give you a set of 3 points that is going to help you. And I want all of you to do it, because the mirror image of the body, as you know, there are so many images of the body. You have a mirror image of the torso here, 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 here. And you also have a mirror image of the body here, 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 here. So that's right there, 10 images. And if you combine it and you apply pressure, that's 20 images. Think about all the good effects you're going to have if you're constipated or if you want to lose weight, and also if you have back pain, to relieve it. But what I want to explain to you is a couple of things, and then we're going to share with you 3 points, and everybody's going to do it with me. So a lot of people have lots of different types of headaches. Let me explain to you different types of headaches that people can have and that do present in clinic with. They have frontal headaches, they have vertex headache, they have temporal headaches, which can also be from the jaw. They also have occipital headaches. And in addition to that, there are sinus cavities, and sinuses were actually there to prevent bugs from going into our brain. Not so much now because we don't live in caves, but there's a sinus set right here, ethmoid and sphenoid. There's also frontal sinus set, and there's also a maxillary sinus set. And those, if they are clogged, can cause a lot of discomfort and headaches. Also with the allergies that are happening, it's so crazy in the Washington, D.C. area. I grew up here. I don't ever remember having this bad allergies. But anyway, allergies can cause the eustachian tube to be clogged, and as a result, you can have ringing in the ear. You can also have dizziness. If you have some of these symptoms, you should definitely talk to your doctor, because your doctor, yes, if you have a sinus headache, Sharon, hang on, let's do these points together. So it can cause dizziness. So any of the aches and pains, these points are going to absolutely help you, but really check with your doctor to make sure nothing serious is happening. So you have that going on in the head. And then the other typical things I see in clinic are the following. So the other typical things is that, of course, occipital headache. You also have neck pain. You also have a bunch of muscles that go here. So you have shoulder pain. You also have scapular pain. Gracie, thank you so much. You also have thoracic pain. You also have lower lumbar pain, and then the sciatic nerve exits right here. So you have sacrum pain, and it also goes down all the way down the leg, or it can go on the back of the leg, the side of the leg, or it can also go on the front of the leg, and it can also result in foot and knee pain. So these are all the different things. So I've designed a set of 3 points that can help you with all of those things. And why can it help you specifically is, remember, think of the mirror image. The mirror image is here, it's here, it's here, it's here, it's here. And it's also here, 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 here. And also here, 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 as well as here, 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 here. So if you access that, then it's going to help you along the way. So what I'm going to do is we're going to do the 3 set of points, and we're going to open it up for questions. And I don't know if you guys have been with me for a little while, but I'm on Instagram and I'm on TikTok, and we post every day. We have YouTube series coming out with men's health, women's health, and weight loss, totally free. You should check it out. And also, all my social media money goes to the free clinics. I have run free clinics 15 years ago, and I'm in a place where I really want to run them in 2024. We're going to start with Washington, D.C., my hometown, nation's capital, and then we're going to move to do it again in Hyderabad, India. That's where I was just about a week and a half ago, scoping out locations and talking to family, because my family's full of doctors. So if you want to help support my cause, I would really love it. And you can do that by becoming a subscriber. It is the yellow star on the lower left-hand corner. I get half the money from TikTok, and it helps me to pay for needles and pay for rent and help people. So just know that all my social media money goes to the free clinics. My passion is to help people through my message. And you can help me by watching my videos on YouTube and also becoming a subscriber here on TikTok. And I give you priority in answering questions, but I do my best to help all you guys. So 3 points, let's start with it. And after we go through the 3 points, I'll open it up for subscribers and questions. So first point we're gonna do, and again, you guys know the rule, hand points you cannot do if you're pregnant because they are too stimulating. So if you're pregnant, gotta sit this one out, no hand and foot points. But let's start with the first point. You're gonna feel really good when you do this point. This is large intestine 4. So I'll do my best to name the points as they are in, I guess, the way that we learned it alphanumerically. So this is large intestine 4. And so what we're going to do is, I like to do the points bilaterally. Just can't do these points if you're pregnant. And we're going to go ahead and do this together. Everybody put their phones down and do it with me, regardless of whether or not you have any of these things. It's going to help you feel better. What is this point specifically going to help you with? Well, this point is going to help you with spinal pain. This point is going to help you with jaw pain. This point is also going to help you with occipital headache pain. This point is going to help you with sciatic pain. This point is going to help you with lower lumbar pain. This point is going to help you with pain down the leg, pain down the back of the leg, the side of the leg, the front of the leg. It's going to help you with medial foot pain. This point is going to help you with not only jaw pain, but occipital headache. So this is a really good go-to point. So any of these points, if you're struggling with aches and pains, including fibromyalgia, I want you to think of doing these 3 sets of points. Only catch is you can't do this point if you are pregnant. So next point we're going to do is I'm really trying to access triple warmer 3 right here. This is where it is. And if you've been with me a while, you know the best part of acupressure is between the metacarpals. They have the most amount of good pressure that can help. So I do my best to really access this tissue right here. And that's what we're trying to do. So this is actually the carpal bones, and these are the metacarpals. So we're trying to access between that. So this point, the way that I try to access it, and again, the hand points you can't do if you're pregnant. So what we're going to do is you can do fist on top of fist. It doesn't matter which fist you do on top, but I can't seem to do it the other way. I guess if you're left-handed, you would do it that way. But I do it just pretty much fist on top of fist. And we're going to do this. Just can't do this point if you're pregnant. This is such a good point to help you with all body pain. Yes, this is a great point to help you with PCOS system because the uterus is right here. So this point can help build the uterine lining. This point is really great for sacrum pain. This point is really great for sciatic pain. This point is really great for hip pain. This point is really great for shoulder pain. This point is really great for neck pain. This point is really great for occipital headaches. This point is really great for jaw pain. This point is really great for sinusitis. This point is also really good for opening up the ear. And how often do you do these points? You can do these points couple minutes, couple times a day, but honestly, you can do them up to 20 minutes, not a problem. So I want you to keep that in mind in doing these points. So this is such a good point that you can do to pretty much open up the side of the head, the side of the hip, the shoulders, and also the low back. So do consider doing this point. So first point we did was this point. Second point we did was this point. And then the third point that we're going to do is we're going to go ahead and do this point. This is small intestine. It's actually, there's 3, 4, and 5 here. So I try to access this area. And the way that you access that point is pretty much you fall off the metacarpal and you get that tissue area. And that's how it is really powerful. So we're going to go ahead and I like to do the points bilaterally. So we're going to do this like this, and that's going to help you to bring blood flow. Gosh, I feel my spine so good right now. It feels so good. So this point is really great for headaches. This point is good for occipital headaches. This point is also good for helping with jaw pain right here. This point is really good for stomach pain. This point is really good for hip pain, coccyx pain, sacrum pain, shoulder pain. This point is really good for spinal pain, pain on the lateral foot. This point is really good for helping you with sciatica down the back of the leg specifically. All right, fantastic. So really, really good. Yes. So again, 3 points that you can do for lower back is 1, 2, 3. Let's do it together. 1, 2, 3. Just can't do these points when you are pregnant. All right, you guys, time to open it up for questions. You guys have been really patient waiting for me to open it up for questions. So if you are a subscriber, you get top priority. I'll do my best to answer all your questions, but subscribers, thank you for supporting my cause of a free clinic in India and also in Washington, D.C. So let's go ahead and give priority to subscribers. And you can become a subscriber by hitting the yellow star in the lower left-hand corner. While I'm waiting for subscribers, I'm going to let all the questions come in and see if there's a pattern and do my best to answer questions. So give it a minute for people to go ahead and answer or give me questions, and we'll go into it giving priority to subscribers. And subscribers, thank you for believing in my cause, and you should check out my YouTube channel. There is really, really good information in there, and you get to see me for some free courses. So let's go ahead and give it another second, and then I'll start answering questions. Yes, if you do fist on top of fist, you can absolutely switch hands. It doesn't matter which order. Just be sure to do the points for at least a couple of minutes. Absolutely. All right, we'll just give it another minute, and we'll go ahead and open it up for questions. You guys are a quiet bunch today. I was really kind of surprised. Sometimes we get so many questions, but lately you guys have been a little quiet. All right. Okay, quiet crowd tonight. Okay, so one question I got for constipation, there is a really simple protocol. So minimum couple minutes, couple times a day. All right, let's go through some protocols. And again, subscribers, you get priority. You totally get priority. So constipation, there's a really simple protocol you can do for constipation. You can do pretty much from here to here for constipation. So do consider doing from here to here for constipation. And you can also do this for constipation. Hemorrhoids, that's a really good question. For hemorrhoids, you can do this. So definitely consider doing this for hemorrhoids as well. Minimum is couple minutes, couple times a day. Hernia, I have to know the location of the hernia. Thank you so much for Gabby, all the support you guys. Really appreciate it. It helps me run the free clinics. Really, really appreciate the love. All the social media money goes to the free clinics. And then diarrhea. This is a really good point. Just can't do the hand points if you are pregnant. You know that. So really, really good. Okay, there was also another question. Oh, wow. Now they're really coming in. You guys are really, okay, let's try to do, wow, you guys are rolling now. Now I got to keep up. Okay. Where do I subscribe? Brianne, you can hit the yellow star in the lower left-hand corner. Addison and Lauren, help Brianne. Lower left-hand corner, you can hit the yellow star, and that is how you become a subscriber. And thank you so much for your support. Really, really appreciate it. Okay, so for tinnitus, as well as for ringing in the ear and for vertigo, simple point is right here. This is a really good point. I've seen it work really effectively. Remember, hand points you can't do if you're pregnant. So you can just simply do this point. If you've got stuff going on here and also stuff in the head, do get it checked out with your doctor. That can really, really help you. For cramps, cinnamon tea can really help you, and also doing this, because this actually accesses the uterus. That's why I don't want you to do it if you're pregnant. So definitely do. Oh, hey, Brianne, thank you so much for becoming a subscriber. Thanks for making my day. Really appreciate the TLC. I really, really appreciate it. Let me know, Brianne, what you want to know, and I will do my best to answer your questions. So thank you so much for the love. So I think we were on cramps while we wait for Brianne to see if she has any questions. Do you have any questions, gal? Let me know, please. So let me know. So this can really help with cramps. This can really, really help with cramps. And then dry eyelid, there's a product on Amazon. It's called Simlersan. That works really, really well. Simlersan eye drops, they're super inexpensive, under $10. And I used to have really bad problems with my eyes, and that has really helped. So I am also, again, subscribers, you get totally, you get top priority. I'm going to do my best to answer all the questions. But Brianne, let me know if you have a question. And subscribers, do let me know if you have questions. Oh, Ginny, thank you, gal. Thank you. Free clinic, here we come. We're going to go and help a ton of people. And thank you so much. Really, really appreciate it. And again, yellow star, become a subscriber. Check out our YouTube channel. Help us support our cause and give it back by running free clinics. I really, really appreciate it. Okay, a lot of good questions. All right, let me go ahead and answer. Thank you so much. All right, subscribers, you get top priority. Let me know what your questions are, and then let me do my best to keep up with all the questions coming in. Wow, you guys are on it. So Addison, Lauren, can you let Sach Diva know about Simlersan? Can you put it in there? And then Brianne, she's asking, do you know how incredibly your healing is? Oh my gosh, you're so wonderful. Thank you. Thank you. I really feel it's my dharma to help people. I truly do. Like, if I could run the free clinic now, I totally would. I'm just trying to be responsible with my hospital job so I can take care of me, and then the social media money goes towards the free clinic. So thank you so much. All right, neck pain. A lot of people asking about neck pain. And let's see, there is a question coming in. I just want to make sure I got it. How long does it take you to feel the effects, and is it permanent? Really good question. And let me also answer neck pain. So what I would say is that all the things that we work with, you should definitely work with your physician. Definitely work with your physician. But what I would say is if you can stay consistent with the acupressure, I have seen some amazing results in clinic. Like I have had patients who've had surgery and then they come back and their surgery, again, I'm not a doctor, I'm not a surgeon, and this is, obviously one case, but they had worse results after the surgery. And I did literally just a few acupressure points, acupuncture, and 5-7 years of discomfort went away. So it can be long term, but you have to stay consistent with it and work with your physician, because I'm here on social media. I don't know your chart. I can't help you. So I can give you tips to help sway the odds. And yes, this can be long term, but do work with your doctor and stay consistent by doing the acupressure. Okay, let's do neck pain. So let's talk about neck pain and let's take care of Brianne. So the thing with the neck pain is pretty much that this is the mirror image. It's like this, right? And if you look at the knuckles, they round out like the shoulders, right? They totally round out like the shoulders. So what you can do to help with neck pain, and I know some of these points are super simple and it's the same points, but they mirror image so many different things. So as long as you're not pregnant, this can really help with neck pain. In fact, Brianne, let's do it together. Everybody put your phones down. It's like you're on repeat. Yeah, because if I keep repeating myself, then maybe you guys will remember, and then I will know. It takes, actually, the research shows that you have to hear it 8 times. So that's why I repeat myself, but all good, all good. So everybody put your phones down. Let's do something. Thank you. So everybody put their phones down. Let's do this together for a couple of minutes. So let's go ahead and put this, and let's do this. As long as you are not pregnant, you can do this point. Let's do this point together. Everybody just fist on top of fist. Let's do this for another 30 seconds. This is going to help with headaches. This is going to help with spinal pain. This is going to help with hip pain. This is going to open up your entire spine. So I want you to do this point, and then we're going to do something else to show you how you feel with neck pain. And also there's a lot of questions about hip pain. So this is a great acupressure point. As long as you're not pregnant, that is going to help you with, rubbing back to back. It's going to help you with all sorts of headaches. It's going to help you with back pain. It's going to help you with hip pain. It's going to help you with neck point. And where is the point? The point is actually here, 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 here. Now I know a lot of acupressurists will be like, here is the point, but actually everything is on mirror images. So if we get the zone, we actually get greater amount of the area. So I want you to go ahead and do this back to back to back. And let's just do it for a little longer, and then we're going to try something, and I want to show you the effects. So if you're just joining us, we are doing an acupressure point for headaches, neck pain, back pain, and hip pain. Also, this can also help you with pain in the legs that is from the lower back. So this is a really good point. So now that we've done this point, what I want you to know, Brianne asked about neck pain, and so many other people did too. So we're going to go ahead and rotate the neck. And now I know some of you may not be able to rotate it because of injury to the neck, but I want you to go ahead and do what you can. And I want you to rotate. Ooh, I can feel a pop and a crack, but I don't want you to stress yourself. I want you to rotate to the level that you can rotate to help yourself. So go ahead and rotate. And then I want you to also around the shoulders a little bit, that as well. Okay, and then one more thing you can do. All the devices are on the second link in the bio. What you can do, as long as you're not pregnant, because this can actually stimulate a contraction, is that you can also massage the top of the shoulders just like this. And then we're also going to do the other side right here. Okay, how do you guys feel? Is the neck pain better? I feel better. So how do you guys feel? Brianne, how do you feel? So I want you to do that, every day. And then what you can do, Brianne, is put an ice pack on your shoulder and then do what I just did right here, just this point, as long as you're not pregnant. And if you can do that over time, you're going to see cumulative results. Really, really good. All right. So Brianne, let me know how you feel and how you're doing. All right, you guys, I'm going to, let's see where, hi there. My neck wasn't hurting upon the rotate. Oh, really good. Just with the Acupod. Okay, awesome. So now you have a go-to. So I want you to do this in the morning and the evening, and it's going to help you. And throw an ice pack on your neck when you get home from work. All right, wonderful. All right, you guys. So, all right, subscribers, Brianne, do you have any other questions? And I believe there was another new subscriber tonight. What other questions do you guys have? If you can let me know what questions you have. Subscribers, please, I'm going to give you priority. I want to take care of you. Thank you for your commitment. And then also, I want to know what other questions you guys have, and let me go ahead and do my best to give priority to subscribers, but also answer questions for everybody. Okay, no problem, Brianne. Okay, what can I do for low blood pressure? Low blood pressure versus high blood pressure. Let's see, below knee pain. All right, hang on. Let's see, let me go ahead and write all these down. And again, calling for subscribers. Do let me know, subscribers, what questions you have. And let me go ahead and take these down. Calling for subscribers and okay, hang on. Let me go ahead. Calling for subscribers. Okay, let me go ahead and answer some of these questions. So we did do back pain, and for back pain, as long as you're not pregnant, 1, 2, 3. So again, 1, 2, 3, as long as you're not pregnant for back pain. Psoriasis and eczema, this is my finding. For psoriasis and eczema, do your best to stay away from dairy, and also do your best not to eat so much sugar, and then also consider kukui nut cream. So kukui is Kukui, nut cream. So, and Alba has a great product to help with kukui nut cream. So do consider kukui nut cream and avoiding dairy for psoriasis as well as also eczema. And as long as you're not pregnant, another point you can do is the lung meridian. So you want to get to the medial aspect of the hand. As long as you're not pregnant, you can take a dry brush and get the dry brush, second link in the bio, and you can pretty much massage along the medial aspect of the forearm, and that can help you. So again, if you're having psoriasis, avoid sugar, avoid dairy. Do consider kukui nut cream. Alba makes a really great product. And then what you can also do is you can do this point right here, and that can help with the dampness in the body. Just can't do this point if you are pregnant. You can use a dry brush, second link in the bio, and do these point in the shower, before, after, in the shower, a couple minutes, and that can help you with the psoriasis. Okay, and then let's talk about, we did tinnitus. Tinnitus, again, is ringing in the ear. So it's pretty much right here, ringing in the ear. So as long as you're not pregnant, a great point is triple warmer 3. So you can do this point to help you with that. So that can be really, really helpful as long as you're not pregnant, to help you a couple minutes, couple times a day. Severe cough, a couple of things you can do. Chestol has a really great cough syrup that can soothe the cough. It really works well. Also, elderberry has a really great cough syrup that can soothe the cough. The other thing you can do is warm milk with honey or tea with honey, it can coat it. You can also take a hot shower and that can help. And for cough, again, the dry brush, as long as you're not pregnant, you can massage the medial aspect of the forearm. There's a point called the three emperors that can really help with cough and asthma and things like that. And you can use a dry brush such as this to help you. So that can help. Just remember, can't do that point if you're pregnant. Just be careful when I tell you not to do certain points if you are pregnant. And let's talk about, let's see, am I a doctor? So I have treated 100,000 patients, and I have a master's in Chinese medicine. I am board certified. I'm nationally certified. And I've been on NBC. I've also been on the Dr. Oz show. So for an acupuncturist, you don't need to be a doctor to treat. I was going to get my doctorate, but I decided to run my free clinic. And I got almost, 10,000-15,000 patient visits when I did that. So to answer your question, I am not a doctor, but I have 100,000 patients visits underneath my belt. I'm an expert in I am an expert in the field, and I'm considered a master. So there you have it. So and then diabetic. So diabetic, there are some points, but you got to work with your doctor. One thing you can do is lime water. Lime, not lemon, but lime water. Take a freshly squeezed lime and put it in water and drink the water, and that will help you. And you got to do it daily, and a freshly squeezed lime. There's also 2 points that you can do. As long as you're not pregnant, you can do triple warmer 3, couple minutes, couple times a day. And then you can also do spleen 4, couple minutes, couple times a day. And that will help you as well. Okay. All right. So let's go ahead and talk about knee pain. A lot of people asked about knee pain. So knee pain, you have lots of different types of knee pain. I saw them in India too. So what type of knee pain you might have is that you may have, let's see, where's my knee? So you might have patellar knee pain. You may have lateral knee pain. You may have medial knee pain. Also, Brienne, lime water is so delicious and cleansing, incredibly detoxifying. Yes, and there's research. You can go to PubMed actually and actually search this. So it's not anything that isn't right there, but lime water, not lemon, lime water. If you are diabetic and if you're pre-diabetic, it can really help you. And it can help you from accelerating diabetes. And if you are diabetic, it can help slow it down. So freshly squeezed lime a day. So do consider it. And then again, back to knee pain. We have knee pain right here, and we also have knee pain right here. We also have knee pain right here, and we also have knee pain right here. Basically, frontal, lateral, medial, and posterior. That's the type of knee pain that we have. So what you're going to do for knee pain is you're going to see your doctor, because if there's a big tear or a broken bone, it can't help you. You need to see your doctor. But if there's a minor tear or a minor fracture, absolutely acupressure can help. So you gotta consider that. And Jenny, good to see you on here. I'm going to answer your question in a second. So for knee pain, you got to remember rest, ice, compression, elevation. So rest and elevate, put an ice bag on your knee, and then what you can do, as long as, so remember, acupuncture is opposite medicine. So if you have right knee pain, you're gonna go to the left hand. If you have left knee pain, you're gonna go to the right hand, and you're gonna cuff the elbow and you're gonna massage it. And that's gonna help you with knee pain. Really, really good. And then Ginny's a subscriber, and subscribers get totally first priority. You're like my VIP clients, and thank you for believing in my cause with the free clinics and supporting my cause. So for heartburn, there are a couple things you can do. You can take a little bit of baking soda, put it in a tall glass of water, and drink it, and that can help you. Other thing you can do is, remember, the mirror image of the body is simply like this. So what you can do for heartburn is you can just acupress the first digit. So simple things you can do for heartburn is a little bit of baking soda in an 8-ounce glass of water and drink the water. Do it every night. It's really going to settle the tummy. And you can do it for gastric reflux as well. And then what you can also do is acupress like this. So for heartburn and also for gastric reflux, again, a little bit of baking soda and an 8-ounce glass of water. Drink the water at nighttime. It really relaxes you before you go to bed. And you're going to acupress just like this, couple minutes, couple times a day. All right. I'm going to do last call for subscribers and last call for questions. And then love the turtles. How you like my ring? My aunt gave me this in India. It's for longevity. So thank you so much. Yes. Thank you, Brianna. We should make you a moderator. Thank you so much. It is totally proven. Also, my patients who do baking soda, they really love it. So, you can do, I guess, organic baking soda, but people just like take, I guess Arm & Hammer baking soda and do it. And it's like less than less than $1, and it can really help you. Yes. So let's see. There's some questions coming in. Again, subscribers, if you want to become a subscriber, yellow star, lower left-hand corner. It totally helps me out with the free clinic. Try to give you VIP treatment. So let me try to round out some of these questions, and we're going to do a nice protocol so you sleep well tonight. So hang tight, everybody. So let me go through and see if I can answer some of these last minute questions. And again, then Addison, talk to Brianne about being a moderator. She's got this. I tell you, she's totally got this. So, okay, let's see. What acupuncture can pregnant women do? Well, let me know what your issue may be, or you should see an acupuncturist and they can do a more customized protocol. We just got to take care of you for pregnant. So pancreatitis, what I would say for pancreatitis is definitely see your doctor. Definitely see your doctor for pancreatitis. But there is a really simple point that can help you, and that is spleen 4. So you can go ahead and massage just like this, and that can help you as long as you're not pregnant. And for pancreatitis, do see your doctor, and this can help you. Absolutely. Okay, so Brianne, if you want to be a moderator, yeah, please message us, and we will do that. You're very good. So thank you for believing in my cause and supporting me. All right, you guys, let's go ahead and put phones down. Let's do a nice protocol to help you sleep well tonight. So everybody put your phones down, and we're going to do a 3-point protocol. It's going to help you take away a little bit of the anxiety, the stress, the anger, the frustration, and it's going to help you feel good, and you're going to sleep well tonight. And that's my wish for you guys. So first point we're going to do is along the midline of the body. You can actually use a wooden comb. Wood in Chinese medicine helps relieve the stress. I know, it's interesting, right? You can get any of these products on the second link in the bio, or you can just use your fingertip, or you can use an eraser. Do what's really good for you. This actually feels really good. I'm not gonna lie. So let's go ahead and do this for another 30 seconds, and I want you to follow along, and this is going to help you to take away the stress, relieve anxiety, relieve frustration, anger, sadness, help you sleep well tonight, right? There's only so much hormone that gets released every day, and we want you to have a good amount of hormone to help you with your health issues, not taken away by cortisol and stress. So this is a great point to help you along the way. All right, next point, I feel good. Next point we're going to do is we're going to massage the rim of the ear. This is a good blood pressure point. For blood pressure issues, do definitely talk to your doctor, but this is a really good point to calming the blood pressure. So let's go ahead and do this point together. We're going to massage the rim of both ears. So let's go ahead and do that together. And oh, I feel good. You guys feel good. I feel good. So let's go ahead and do this for the next 30 seconds. And after we do the live, I want you guys to check out my YouTube channel, and then I want you to go to bed. So I want you to get a good night's rest, and we're going to be on here tomorrow night And we're gonna do it all again. I want to get you guys good acupressure so that you know how to help you along the way. So this is going to help you to moderate your emotions and help you to sleep tonight. Okay, next point that we're going to do is we're going to go ahead and take the top very vertex and we're going to go ahead and massage like this. And this, some people may consider this like a tapping technique, but this is do 20. It's an acupressure point, and it actually helps to build the essence in the body, and it helps by balancing out head to spine, by bringing blood flow along the spine all the way to the lower abdomen and then the core, which also balances out to the top. Remember, top to bottom, and that's the holographic image we are doing. So we're going to do this for a little bit, and then what we're going to do after this is we'll be back here tomorrow night. Check us out on YouTube and also on Instagram. And I want you to consider checking out our YouTube. We have free courses, free, totally free. Really great tips and really great courses. We just released a series on men's health, so do check it out. All right, you guys, it was a fantastic live tonight. And Brianne, thanks for making my night tonight. And you guys have a great Wednesday. Wednesdays are tough, but you'll get through it. And I'll be back here tomorrow night and we'll do some more acupressure. Love you all so much. Have a great week. See you tomorrow. Bye-bye.